The origins of World Symposium really go back to an attempt to bring together many medical centers around the country, maybe from around the globe, into a single network clinical research consortium.
I usually like to tell the story about the first meeting that predated World, which was held at a renovated train station in downtown Minneapolis, and there were 35 people there.
I was involved in the formation of the WORLDSymposium back in the early days, about 20 years ago, working with Chet Whitley and a few leaders in the field in moving lysosomal disease research forward. It takes a village to move things forward, so it's not just one individual person or group of individuals. It's really the community coming together.
Initially, there were two different lysosomal sort of programs going on. The one I mentioned that happened at the train station that Chet started to develop, and one that predated that a little bit.
The applications that came in were unsuccessful, and that was because the reviewers, the scientific reviewers, thought that the field was too fragmented and unfocused.
I said, there should be just one meeting. You should put your money into a single meeting and let it grow.
And I really commend Chet Whitley for being the herder of cats and bringing together a community of investigators, patient advocates, as well as industry leaders to start working together through this series of workshops that eventually led to the development of the WORLDSymposium.
Everybody put their own individual issues aside for the purpose of collaboration, so that when the next round of proposals could be submitted, there would be one proposal submitted from the lysosomal community, and that was the Lysosomal Disease Network.
What really caught my attention was that there was not really a whole lot of communication going on, not only amongst the scientists but also amongst the patient advocacy groups. They would be funding their own disease based on their advocacy. So we'll pool our money, and instead of funding our own mission-specific diseases, we'll collectively fund lysosomal diseases, recognizing that any strategy, any approach for a particular lysosomal disease can actually advance all lysosomal diseases. And so applications that were not successful by NIH peer review system were given a second chance, and the funding was typically for 1 year, which was sufficient for them to get the data that they need. 100%, every individual application that was funded by the organization got successful in getting an R01.
One of the great achievements of WORLDSymposium is to, starting from a mainly US or North American based event, to become a truly international event, and the most important event when the community working in lysosomal diseases bring their contributions and also make the most possible interactions to advance in the field.
The WORLDSymposium would be now the international event that synthesizes basic science, clinical science, new therapies, and risk for families and individuals. And it's the only meeting that does this.
My son has got a condition called multiple sulfatase deficiency, and from talking to some researchers in my home country, they pointed arrows around the world at different places, and WORLDSymposium was pretty much on top of the list of conferences that I should absolutely go to try and connect with as many researchers as possible under the one roof at like such a big conference.
From the very earliest days of trying to determine what might be needed for the broader lysosomal disease community, patient organization leaders were involved. Just like the clinicians, just like the bench researchers, just like the industry that was going to help to support the effort. And that respect, inclusion, partnership with the patient community, I think has really helped with World's growth.
I'll just never forget when some of these dads walked into the room and they would raise their hand and tell their kid's story and say, what can you do for my child?
This conference has, make unique efforts to include patients. Not to say that others don't, but they really, really kind of go the extra mile to include patients. And this is really nice, welcoming, and it makes you want to return.
I have been attending World since the very first one. In the field of genetics, I think collaboration is the key. And as someone who's been very passionate about our children with lysosomal diseases, recognizing the importance of early diagnosis so that we can impact outcome has been on my mind from the outset.
I think WORLDSymposium is an incredible venue to connect all these clinicians and scientists and genetic counselors and everybody who touches the lives of these patients. So yes, attending and presenting at WORLDSymposium has been incredibly helpful. It definitely takes a multidisciplinary team, and it's just been a privilege to be a part of it.
So I've been coming to the WORLDSymposium, I think, almost every year in the past 10 or more years. It's fun to meet again and again old friends and make new. I particularly enjoy the way the platform sessions are organized now. These 4 sessions, one after the other, and then 10 minutes of questions and answer. I think it's brilliant.
While it has a singular focus of lysosomal storage disease, it still encompasses the myriad diseases that are under the umbrella of lysosomal storage disease. And it was so exciting to see all of the basic science research all the way up to clinical trial research. And I always love how World does that. It progresses from the beginning of the conference with basic science bench research and takes you all the way through to clinical trials and groundbreaking research at the end.
I've grown up, essentially, if you will, as the WORLDSymposium has evolved over the past couple of decades. And maybe to rehash a little bit, but it feels like home to be able to go and see my friends, collaborators, and see excellent research being presented, and to foster, my own scientists as well as the folks in the mentoring sessions. It's been pretty darn satisfying.
My first experience was in 2010, so that was my first trip to World, and since then I've been there every single year, barring one. I honestly, truly think if there's one uniqueness, apart from being a real true family, it's that opportunities that we get to network. The networking opportunities are endless when you're there at World.
And that's really what it was. It was that collaboration, but having every stakeholder involved, having a piece of it, being able to share their opinions, and having everybody listen to, I think, is what is so key.
The meeting owes a great deal to the meeting organizers. They've really done a marvelous job of keeping things moving well, making it interesting for the scientists and clinicians, and modifying, improving the meeting in ways that make it one of the most amiable, interesting, and important meetings in the world.
I think it's obligatory to attend for anybody who is interested scientifically or clinically in research on lysosomal diseases, and I strongly recommend it.
I want to congratulate Chet and all the folks that have really been making this happen over 20 years. It's so much work, I imagine, and so I want to congratulate them.
WORLDSymposium for me, yes, the sessions are fabulous and you learn so much, but also the networking outside of the conference center, going for dinner with some of the best scientists and doctors in the world, sharing ideas over dinner, maybe over some drinks. In time you can become friends with these people, and they can really help to work with you to try and make an impact on your disease.
And this is what you have today now, the WORLDSymposium 2024, our 20th annual meeting.